everyone, welcome back to my channel Navjot Talks. This is Navjot. I'm a registered nurse in Canada, currently practicing in Ontario. In this video, I'm going to talk about one tool that you can use to assess your clients for depression. I'm going to talk in another video about depression in detail because I have seen people using it very often. Depression. But what depression is? I'm going to talk about that in another video because it's going to be another level topic. It's in itself a big topic, huge topic that needs some sort of time to elaborate on, right? So in this video, I'm going to talk about the tool. If you know that one of your client is suspected for depression, you know that nurses cannot diagnose, right? I just want to make sure that you know that nurses can't diagnose. They can just assess the residents and they can use the S-bar tool to communicate with the other healthcare team members, and the diagnosis should come from the doctor or the physician. So in this video, I'm going to talk about the tool that you can use when you're assessing. The name of the tool is SIGECAPS. SIGECAPS. S is sleep. When you're talking to someone that you know is suspected for depression, you can ask them how's their sleep. Now, if you ask someone how's their sleep, they might not be able to give you a correct answer because if they're suffering with mood disorder or depression, they don't really have those words to elaborate on. You might want to ask them a question in a way that they can pick up the keywords and can help you. So how you can ask them is, have you noticed that there is a change in your sleeping pattern? Are you sleeping more than usual, or are you sleeping less than usual? Are you struggling to sleep? Are you finding yourself sleeping more hours than you used to do before, right? This is how you can ask the question about sleep. Now the next is I in the SIGECAP. I. Now that I could be interest. So you can ask your client that how's your interest, but if you ask them simply how's your interest in what, how can they answer you? You might want to ask them a question. Do you find that you don't like to do the activities that you used to love before? And have you noticed a significant change in your interest to do the activities that were your favorite? Okay, so the client might be able to think, yes, I used to love gardening, but I don't have any interest in that. I used to watch TV, but I don't find it interesting anymore. This is I. G. Now G is the guilt. You want to ask them if they are finding themselves guilty of anything. You know, sometimes there's a history. The clients that are suffering with depression, sometimes the root cause is they know they have done something, or they think they have done something, that they're finding themselves guilty of doing it, and now they're in depression or they have bad mood. So you want to ask them a question. Have you ever felt guilty of doing anything? Do you feel that your family or someone thinks that you are guilty of doing something that should not have happened? Do you find yourself guilty of doing something, or something that happened in your family or in your life that should not have happened, and it happened because of you? That's you're gonna find out how they're feeling and if they're feeling guilty. Now E is energy. So you want to ask them how's their energy. So the question that you can ask in this case could be, do you feel that you get tired easily even after taking few steps? Do you feel tired easily even after doing some work for 2 to 3 hours? So when you're asking some questions like this, they might be able to tell you, yes, before that I had energy for 7-8 hours. I was able to perform all my job duties, but now I find in the middle of the days, around after 4 or 5 hours of performing job tasks, I feel that I don't have any energy left and I want to have some rest. Do you feel that you want to take some naps during the day because your body's tired? Do you feel that you are not able to take care of yourself, your home, because you don't have energy, right? So SIGE done. Now comes to the C, cognition. So you want to ask them a question. Is there any change in the cognition? So how you want to frame that question is, do you find that you're not able to recall things? Do you find that you are struggling to memorize things? Do you find yourself struggling to recognize the things that you were able to recognize before? Do you find yourself having some memory gaps? Do you find, like, the cognition, how they're thinking, if they're intact, if their cognition is declining? This is some sort of question that can help you. If they have some memory gaps, they're not able to recall things. Now, SIGEC, done. Now comes to the appetite. So I have seen people using this question, how about your appetite? But someone who is suffering with depression or mood disorder will not be able to give you a correct answer, because they need some sort of trigger so that they can really check on their own status and answer you back. So you want to put it in easy words. So how you can ask them is, have you felt that your clothes are more loose? The clothes are loose or tight now compared to earlier? Do you find yourself losing weight? Have you noticed a significant change in your weight now? Have you noticed that you're gaining more? Are you able to eat? And have you noticed that if you're not eating, you're putting on more weight? Or even if you're eating, you're still not gaining weight, or you're losing weight? So you want to frame the questions in such a way. But the best one that I have always realized that works for me is, I always ask, have you seen a change in your weight? Do you find your clothes becoming loose or tight day by day? Right? So we are trying to catch the information from the last 1 month at least. But if they notice that this, because see, you have to check on yourself. I check on myself. The clothes that I am wearing today, if I find that they are a little bit loose or they are tight, I'm able to see that. I'm able to feel that. So this is the same story with the people who are suffering with mood disorders and depression, because you will see that people with some mental illness, they will either eat a lot without realizing, or they will stop eating at all. That's the whole point of asking this question. Now, SIGECA, done. Now comes the P, psychomotor. You want to ask them question that will help you to come to a conclusion, at least something that is related with their psychomotor functioning. So when I ask my clients, or when I'm teaching students, I always ask them to ask this question to their clients, that have you noticed that you're not able to coordinate the movements of your body? For example, when you're trying to comb your hair, when you're trying to put on your clothes, are you finding that you're losing balance? Are you able to maintain the same posture, or you're finding that you're losing balance, right? So that is one way to ask it. You can ask in numerous ways, but this is one good way, because everybody likes to comb their hair, and then this is one thing that everybody does, and you can easily ask this. SIGECAP, done. Now comes the S, that's the suicide. Very sensitive and very important. Now you don't want to simply ask, do you want to commit suicide? Do you want to end your life? Because it looks weird. If someone is not really suicidal, they might think, what are they asking? Am I really that bad that they have to ask me this question? So you want to put in certain words that it doesn't look bad to them, it doesn't look offensive, and then you can put it in ways that looks professional. So one way to ask this question is, I have one question for you. This is like if you're a client. I have one question for you. I know it's going to be a little uncomfortable, but as part of my assessment, I still have to ask this question. Please let me know if you feel uncomfortable, and I'll stop in between. Okay? You're gonna make sure that you give them some sort of explanation why you're asking this question, right? You want to make sure that they are aware why you're asking, like a part of your process, right? The part of your tool that you're using. So you will ask them, if you die, do you think it will matter to someone? Do you think somebody will feel bad if you die? Do you think people care that you are alive, or if you're dead, they will care? Do you think your life is worth living? Do you think that you are important to anyone? Do you think your life matters to anyone? So you want to make sure how they're feeling about being alive. If you simply ask them, do you want to commit suicide? Why? If you ask them in certain way, that ask them a little differently, like I am telling you, what will happen if you die? How will people react to your death? How will your loved ones react to your death? What will happen if you're not alive anymore? then they might give you an answer. Nobody cares. If I'm dead today, nobody cares. I wish I could die because I know even if I die, nobody really cares. It doesn't matter if I'm alive. It doesn't matter if I'm dead. It doesn't matter to anyone. No one in my family cares. They haven't seen me for the last 2 months. It might give you a bigger picture. It might give you some sort of idea what are they thinking. Now see, whatever the clients with depression are thinking is not necessarily true always. It's their perception, how they perceive the things and how their brain is processing that information. So if you use SIGECAP in a way that I told you, SIGECAPS, you will see that on the paper that you are writing your information, you will have a lot. How's their sleep? How's their cognition? How's their interest? How's their appetite? Are they losing? Are they gaining? Are they waking up early in the morning? Are they not able to sleep at night? What are they thinking about the suicide? And if they ever answer yes to your last question, that's suicide, then you should really get worried, because now they have told you they're suicidal, they want to end their life, and they get those intentions. They have some intentions in the mind that they want to end their life. Now your next question will depend upon the answer to this question. If they say no, they're not suicidal. If they say yes, of course my family will cry, it really matters to them. My mom and dad loves me a lot. It's just my mood that's not fine. I know people care about me, but I'm not in a good mood at this moment. They might be able to tell you that their life really matters to someone and they don't want to end their life. It's just that they are upset or they're depressed. If they answer in this way, it's fine. You can use the other answers to frame your plan of care and to talk to the doctor and get order for the medication or the treatment plan. But if they say yes, like they tell you that nobody likes them, nobody really, it will not matter to anyone, nobody will care if they are dead or alive, then you will ask this question, okay? If you ever have to end your own life, how will you do that? What is one thing that you will do to end your own life? They might say, if it was in my hands, I would have just killed myself with the rat poison. If I had access to this bridge, I would have jumped from that bridge. Now they're telling you the plans. And sometimes you will see the residents in the long-term care homes, they might give you some answers like, I would wrap this card, the call bell card, around my neck. I would jump out of this window. Now that tells you where the risks are. For example, the window. They have told you the window. They will try to jump out of the window, though they don't know that the window that is there in the room that can be open, that can be accessed, that's not that big window that you can jump out of it or they can jump out of it. But as a nurse, you know that what their intentions are now. So you want to make sure that somebody keeps an eye on them and the windows around them, they are closed, because that's their focus, right? That's their plan. They might try to jump out of a balcony or any other window that is big, huge. They might just break the glass and jump out of it. And if they say, I will wrap the cord around my neck, now that will worry you because everyone has a call bell in the room. So in that case, you want to work in a different plan of care. And you want to work in a different way in the plan of care, the treatment plan, so that you know that risk is at least removed. And if they say, I'll use the rat poison, and if you're a community nurse, you know that this person is living in their own house and they might have access to the rat poison, but they might have not purchased it. Or if they're living with the family member, they might, you want to make sure that they're aware that this is the plan, right? And you want to make sure that they are safe. So this will help you to analyze where the risks are and how that risk can be removed from the immediate source, can be removed from the client's access, right? From the client's zone, how you can remove that risk so that they can't commit suicide using one of that method. So this tool, though it's very simple, maybe it will look like I have made this big video on this topic, but trust me, when it comes to assessing someone with depression or mood disorder, I have seen people running short of words. I have seen people getting nervous and they get panicked because it's a sensitive topic and they don't know how to start communicating. But if you use this tool, you know that, okay, somebody asks you that this is a client with the history of depression or not feeling good today, you might just want to go and start asking these questions. So this is a tool which is really, really helpful. And please make sure whatever tools I'm telling you, you just don't listen and ignore. Start practicing on them, start using them, because these tools are really helpful, and they are the tools which I have seen that they have been proved to be effective. And if you like my videos, don't forget to subscribe, don't forget to press the bell icon, because I make videos for your benefit. And these tools, whatever tools I'm sharing, S-Bar, SIGECAPS, they are really effective tools. They have been used by many, many healthcare professionals, and you can start using these tools in your practice today, in your clinical settings today. And if you like to also share with other people, you can share my video, or you can also talk about the same tool, and people will get benefit out of it. These tools are really effective, and they can change the whole game in the healthcare field sector, and they will make you feel more confident and comfortable with your skills. I'll see you in next video. We'll talk about another tool, or we'll talk about another topic that is important and will help you in some way or the other. Till then, take care. Bye.